Children born during the early months of the pandemic scored somewhat lower on developmental skills tests than males born before the pandemic, according to research released Tuesday, regardless of whether their mothers contracted COVID-19 during pregnancy. The study, published in JAMA Pediatrics, followed 255 babies born in New York City from March to December 2020. New York City was the hub of the outbreak in the early days of the epidemic in the United States. At 6 months of age, the infants were assessed for social, communicative, and motor abilities using a standard questionnaire that included questions on their ability to roll from back to stomach, how often they chatter, and other milestones. In most places, boys born during the outbreak scored lower than boys born before the epidemic. This was true whether or not babies were born to moms who had contracted COVID during pregnancy, according to the researchers. They went on to say that the findings might not be predictive of long-term developmental delays. The differences between children born before and after the outbreak were modest variances in mean scores, not larger developmental delays. While social abilities, fine and gross motor skills, and communication skills were all lower among children born during the epidemic, communication skills were marginally higher. Of course, it comes to a halt. Why do these kids score lower on what I perceive to be fundamental skills, such as motor skills? Sean Dion, an associate professor of pediatric research at Brown University who has studied children's cognitive abilities, said this. Who were born during the outbreak but didn't take part in the JAMA pediatric study. Because adults' masks obscure their mouths when they talk, and infant interaction has been limited owing to the lockdown, he expects to see an impact on children's communication. My first idea was that things like language would be damaged but not the motor, and we're seeing the opposite, Dion explained. All of the participants were born at Morgan Stanley Children's Hospital or Allen Pavilion Hospital in New York Presbyterian, and their outcomes were compared to those of 62 infants born at the same facilities before the outbreak began who were likewise examined at 6 months of age or older. The researchers hypothesized that the stress that pregnant women are feeling as a result of the epidemic could be to blame for the deterioration in children's motor and social skills. However, research main author Dr. Danny Demetrio, an assistant professor of pediatrics and psychiatry at Columbia University and a neonatologist at Morgan Stanley Children's Hospital, believes this is due to a combination of variables. She believes that the impact of giving birth in a lockdown setting, as well as other strains linked with the epidemic on families who have had their childhoods disturbed, such as job losses or unstable housing, may have had a role. She called the findings surprising, particularly considering the researchers found no poorer scores among newborns whose mothers had the COVID virus during pregnancy compared to kids born during the pandemic to mothers who were not infected. Based on what we know about other viruses, she said, we expected there to be a difference. Molly Wood, an associate professor of epidemiology at the University of North Carolina School of Global Public Health and the lead author of an editorial published alongside the JAMA Pediatrics study, warns that these findings should not be used as a reason for pregnant women to forego vaccinations, booster injections, or mask use. She also stated that the study has flaws. It's a very tiny sample, taken over a very short period of time from a very unique health system in New York City, she explained. It's not that we can't learn from things this way, she says, but it only addresses a small portion of the problem among pregnant women. While research on how COVID affects the development of unborn children is still ongoing, there is abundant proof of the disease's other dangers to them. Pregnant women who have COVID are more likely to give birth prematurely, which can leave their newborns with lasting problems including cerebral palsy. Stillbirths are also increased by the virus in pregnant women, however, the overall rate remains low. What does this mean in terms of the future? It's unclear what the ramifications will be for the 6-month examination's outcomes. Growth occurs at a very early stage of 6 months. It isn't a reliable predictor of long-term consequences. It's a good indicator of what's going on right now, Demetrio explained. However, gathering this information early is crucial because it provides a tremendous chance for action if it becomes evident that the epidemic is having long-term negative impacts on particular children, she added. Growth occurs at a very early age of 6 months. It's not a reliable predictor of long-term outcomes. We can really start talking on a public health level about what to do and mitigate any long-term impacts since 6-month-olds' brains are really malleable and plastic, Demetrio added. Diani, whose research published in August 2021 indicated that children born during the epidemic had lower cognitive skills owing to the lockdown, called the discovery extremely important. If things stay the same, there will be a cohort of children entering daycare, preschool, and school that will be in more need than we are accustomed to, he said. He did emphasize, though, that families are not weak. He believes that children's brains are resilient and that the most essential thing parents can do is be involved in their children's daily life. Reading to children at night, he said, is a wonderful way to bond with them and help them grow. If your parents talk to you a lot, play with you, interact with you, or just sit on the floor with you, it will pay off, he said. Thanks for watching. If you enjoy our content, please like, share, and subscribe.